today. We're going to go ahead and do a bladder scan real quick to see how much fluid's in your bladder. Can you tell me your name and date of birth? All right, perfect. Are you in any pain or anything right now? Okay. Well, I'm going to go ahead and get started. All right, to set this up, I'm just going to turn it on and select scan, and then I'm going to pick the patient's gender, which is female, for her. And I'm going to raise the bed up. Try again. All right, I'm going to go ahead and put a little bit of ultrasound gel. This might be a little bit cold.
Okay, so
Okay.
you like up in.
You got the summer method.
And press scan.
You go.
That's what I did.
All right. This is showing that your bladder has 250 milliliters in it. So I'm going to go ahead and go get an intermittent catheter to alleviate some of that fluid. And we're also going to take a sample of your urine. So I'll be right back. Okay, close the curtain. Hi, I'm Laura. I'm your nurse. Today we're going to be doing an intermittent catheterization like I talked about earlier. Go ahead and clean my hands. Can you tell me your name and date of birth? All right, perfect. Everything matches. Are you in any pain? Okay. And are you allergic to anything? Great, everything sounds good. So I'm going to go ahead and get started. Try to get these gloves on. Alright, I'm going to have to go ahead and reveal you a little bit. And on a normal patient, I would ask them to raise their legs for me, but since this is a mannequin, I'm just going to do it for her. With the feet about 2 feet apart. And then if I had a drape of some sort, I would be able to drape her, but we don't have anything in the lab at this time, so I'm not going to do that. I'm going to go ahead and clean the perineal area with some water, warm water, and really mild soap. So we're going to get some of that. And then we're just going to clean from top to bottom and from outside to inside using a new piece of the cloth every time. Okay.
You're just kind of observing and then you're going to do it tomorrow.
Throw that away. And then I'm going to go ahead and dry off using the same technique. I'm going to get rid of this to make room for
In practice, I have scrubs on. I have my hair up.
more stuff.
Hello, I'm Elena. I'm your student nurse today.
At this point, I'm going to remove my clean gloves. And go ahead and set up my sterile field.
Okay. Ready? 1, 2, matches. I'm going to be performing a bladder scan to assess the industry catheterization.
Can you state
get
your
my gloves
name,
on,
date of birth for me?
and if I can have you pull your pants down just a little bit to expose your bladder.
Okay.
I would.
And then I'm going to go ahead and put on my gloves as well.
Bladder scanner and make sure it's set to the female patient.
Curtains to provide you some privacy. We're going to be doing
Start by
intermittent catheterization today.
into this.
And I have already raised the bed so it's your working height for me. And
Generous
I'm
amount.
the patient.
After I palpate this,
Now I'm going to open
and then go an inch above.
the catheter tip.
I am going to make sure that the end of this is pointed towards the patient.
I'm going to put on my
So I'm going to go
sterile
ahead and
gloves.
start. I'm just going to be looking around for
Alrighty. I'm
any
going to go ahead and remove
buildup
this so I have more room to work
in
with.
the bladder.
And then at this point, I'm going to put this
And-
blue drape down to make sure we have a nice sterile area to work with on the bed. It's going to be a little bit more difficult on the mannequin. On a real person, I would have her just lift her buttocks up so I could slide this under without touching her. But since it's a mannequin, we're not really going to be able to do that.
Right, and then I will use
I'm just going to try to be as careful as I can and try not to touch her and let any of the white part touch the bed. Kind of slide it in there. Okay. At this point, I'm going to use this fenestrated drape to cover the area around the perineal area so that we can have a sterile surface. Again, making sure that this doesn't touch anywhere that it shouldn't. Okay. Alrighty.
Up a little bit.
And at this point, I'm just going to go ahead and move this entire container over so that I can keep a good eye on my sterile field. And then I'm going to go ahead and clean her a little bit more with these swabs. We're going to do one swipe on either side and then one in the middle. Just one single swipe and then throw that away. And on this side. And then this will be the final one. And once we get to this stage, I'm going to go ahead and have to pick a sterile hand versus a clean hand. So since I'm on this side of her, I'm going to go ahead and make this my clean hand. So we're going to have to go ahead and spread the labia, and then we're going to go ahead and swab the side. We're going to throw that away. And then at this point, I'm going to remove the sample cup, which is where we're going to drain the bladder into. At this point on a normal client, I would go ahead and lubricate the first about 2 inches of the catheter, but since this is a mannequin, it could cause issues, so we're not going to do that on her. So I'm going to go ahead and get the catheter in this hand, my sterile hand, and put the edge into the sample cup. Be really careful to keep spread. And then we're going to insert this about 3 inches or until we have urine going into the cup. We're going to twist. We're going to have her bear down slightly. Go ahead and twist if we need to. Okay. We've got urine flow, so we're going to go ahead and wait until we have enough urine for the sample. Okay. And that's all the urine she has, but if she had more urine, we could go ahead and use this container. But we won't need to do that. So we can go ahead and remove the intermittent catheter and throw this away. And then I'm going to go ahead and take the sample lid and put it on the container, trying to keep everything sterile. And touch the outside with my clean hand. Go ahead and close this container, and then I would label it, and then that would be sent off to the lab to go ahead and get lab results. So at this point, I can throw away all of my materials that I've used. And then I can go ahead and lower the patient's legs so she's a little more comfortable.
I know. I'm always like, let me just
Replace her gown and put this on. And then I can take off my sterile gloves and throw away all of this trash that I made. And then go ahead and ask if she's comfortable, if she needs anything, and then leave her be.